All right, Rebecca.
Okay.
Emails for you.
More.
Many to get into. What do you say?
Again.
Middle tier patron Caitlin, she says, Dr. Kirk and Rebecca, I recently found out about premenstrual dysphoric disorder.
Oh, yes.
And think I may have a mild form of it.
PMDD.
I tried turmeric candles and apple cider vinegar.
And it was ineffective.
And it did not help.
God damn it.
Would you share your knowledge and experience with this? Also, what about rejection sensitivity with it?
Oh, yeah, sure.
Thanks, Caitlin.
crap.
What do you think?
Yeah, it's so obviously anything with women's health is vastly understudied and there's not a lot of knowledge around it. It's a hormonal imbalance that happens just before your period starts. You should find some kind of specialist to address this. And I will say I have one client that her symptoms were so severe she went into medically induced menopause in order to try and address it, and that was the only thing that worked for her. And this was after years and years and years of trying absolutely everything that's out there. I don't know where she is, but certain countries do it better. Like Australia does it way better than we do in terms of medications and understanding. So it is either a Western medical doctor or an alternative health specialist. Also something like an abdominal massage can also help. But yeah, this is not something you address on your own. This is something that you work with a professional to try and figure out. And it can really impact relationships.
Mm-hmm. Yeah. Yeah. So this is just my cultural sense of issues like this, like peripartum depression and anxiety as well, that people will downplay it, one, because it's women's issues, and two, because there's a fair amount of moodiness or stress for everyone going through their menstrual cycle and also, around birth. And so I think people will downplay other people that are having more severe reactions as like, well, you're overreacting or it'll clear up, just give it a couple days. When it's like the general misunderstanding is like, no, this is way beyond
Mm-hmm.
and actually is kind of dangerous on a number of levels, not only for the individual, but in the case of postpartum, it can severely interfere with parenting and can actually affect attachment with the child, And it's not to shame the person, but support, understanding, treatment, medications, this kind of thing is extremely important. One thing that's often downplayed is people know about postpartum depression, but a lot of people don't even know that postpartum anxiety is a thing. In fact, I think some stats demonstrate it's even more prevalent.
Mm-hmm.
And anxiety is also just generally misunderstood. People are like, oh, you're a little nervous. No, like anxiety is life-ruining.
Mm-hmm.
It is completely debilitating. It's completely misunderstood. As someone that suffers from anxiety myself, I can tell you that most people are just, even therapists that I've talked to are just like, oh, they just seem to think it's stress. It's like, there's a reason why it's in the fucking DSM. You know what I mean? But when it comes to rejection sensitivity, there's not a lot of research demonstrating a direct correlation there. And there's also not a lot of research on the topic. But my sense is that the rejection sensitivity that some people might experience with premenstrual dysphoric disorder is probably related indirectly through the mediating factor of the depression and anxiety and feeling alone. Imagine you're frequently every month going through this really horrible time and
which can last, I believe the statistics are like it can last for up to 2 weeks.
Yeah.
Yeah.
Yeah, it's not just like a day.
Right.
But it can be. But the point is that it can be very alienating, lack of support and people misinterpreting you or not listening to you when you're saying, I have a particular bad case of premenstrual dysphoric disorder, and they're just like, oh, maybe even other women are just like, oh, I get a little cranky on my once a month as well, and it's just like, no, you don't understand. This is way worse. I'm a completely different person in this state, And through that stress and alienation, we all are sensitive to rejection. But if we're stressed out, we're going to be a lot more sensitive to rejection. But that doesn't really help necessarily, but it is a known symptom for some people with premenstrual dysphoric disorder. So absolutely. All right. Another email here. Highest tier annual patron, Jocelyn
tier?
G. Yeah. Good old Jocelyn G. She writes in a lot. I'm a big fan of stand-up comedians like Ronnie Chang and Jimmy O Yang who discuss their parents in a comedy context, often referring emotionally distant often referencing emotionally distant fathers and target market. Okay, so Jocelyn G is like, I'm a big fan of these Asian American comics who will talk about, common Asian American parenting experiences. I imagine this comedy lands so well because it explores an often painful topic for this community. On the other hand, there are Asian American comedians who rose rapidly on TikTok who discussed more nuanced experiences on stage. An example of a nuanced mainstream comic is Atsuko Okatsuka. Who,
excellent pronunciation. Thank God that was you, not me.
I don't know if I've ever heard her name.
Okay. I sent you some of her stuff. She did this very funny piece where it's her and an East Indian woman comedian, and they're comparing their two foods, and they refer to miso soup. The East Indian woman refers to miso soup as salt water.
Yeah. Well, you sent that to me.
That was so funny.
Yeah, so I included this email in your episode because I know that you like this Japanese American. Actually, she's born in Japan, right?
No, she's born in Taiwan.
Oh, Taiwan. A Japanese person born in Taiwan. Well, because Akatsuka is not a Taiwanese name. It's a Japanese name. So, I mean, but who knows? Maybe a Japanese father, or maybe Atsuko married a Japanese. But Atsuko is also a Japanese name.
Yeah.
So.
Well, okay.
Anyway.
Her comedy focuses a lot on her schizophrenic mother.
Okay. Let's see. I find I enjoy the more nuanced stories more, but still respect the need to talk about cultural stereotypes on stage. End of email. Yeah, I mean, Asian American or Asian comedians who speak English are not a monolith, right? You have a lot of different voices.
Well, and I think of the person that I knew that did this was Margaret Cho, talked about her family and got a TV show out of it.
You're right, yeah.
Yeah.
What was her big thing? We're going to go Montgomery Wall, right? It's make fun. But Ali Wong is another name.
Oh, yeah. But she doesn't really talk about her parents. She talks about her husband and her kids.
She talks about Asian stuff.
And her rampant sex life. My God, is anybody getting it more than her?
Well, Asian Americans, on average, I find they haven't absorbed the kind of white people shame around sex. I mean, there's certainly complexes around body and sex and sexuality and gender and everything, but I find that Asian Americans, on average, are just freer to be more human, and women, I think, in particular. Of course, there are plenty, particularly like Korean, because they're more Catholic and stuff. But so it's hard to lock things down. But
and that's
Ali Wong very much reminds me of a lot of Asian American women that I grew up with.
And that's something actually we talked about in the sex therapy program. There was a whole module on this about Buddhist and Hindu and Jewish cultures focus on that sex is a blessing versus Christian culture that sex can be dirty and you shouldn't talk about that.
Yeah.
So anyways.
And Ali Wong in her earlier stand, and I've seen her live.
Oh, yeah.
Oh, yeah. And I mean, her first Netflix special, I think it was, like, crying. And, of course, in Beef, she's great.
Yeah.
But the part that Ali Wong, I do remember her making a joke, because she used to be married to a half Japanese, I think half Filipino. And herself, she's half Chinese, half Vietnamese, I think. And so she would get into details around, like, my Japanese Filipino husband, here's how he annoys me, and I annoy him with my Chineseness. And so I don't know. There were a lot of jokes like that in the beginning. They've since divorced, and now she's dating the guy from SNL, Bill Hader.
Power couple.
And she brought him on stage when we saw him when we saw her live in Seattle. But anyway,
also extremely funny.
yeah, very funny. Yeah, interesting guy.
Yeah, that show that he has on HBO where he plays this serial killer.
Barry,
yes. Amazing. Anyways, what are we talking about?
But I also want to mention
fun of our
another
families.
Asian American, the first real Asian American stand-up comic that I think people forget about is Shang Wang. He is from Houston, Texas, born and raised, and has a Texas accent. Like if you just heard him talk, you would not think he was Asian American. But the thing I appreciate about him is that he is like all the Asian Americans I know, which is that we're American, first, and depending on the generation, right? Because I'm like fourth generation, and so the tiny thread of Japaneseness that's in me is imperceptible in a lot of ways. You know what I mean? And this guy Shang Wang, it's hard to see him as an Asian American, the way that he talks. And I remember seeing him, I don't know, maybe 20 years ago, and he's on stage and he starts talking, and then he immediately says, "I bet you've never seen an Asian guy with a Texas accent." And he's like, I was born and raised in Houston, and I just thank God, you know what I mean? Because every time there's an Asian actor in a movie or TV show made in America, made in the United States, before they talk, I'm praying to God, please no accent, please no accent, please no accent. And there's always a fucking accent. They will take someone who, born and raised in the United States, no accent, and they'll make them have an accent. Asian is foreign. Asian is the other. Asian is exotic. And it drives me fucking nuts. And so when Shang Wang gets on stage and has a Houston accent, I say, thank fucking God. Let's take a break.
Oh, God. What was even the question?
I don't even know. I mean, well, Jocelyn G was basically just saying that she appreciates more nuanced points of view about Asian American parents.
Yeah.
Not always reducing it to the tiger mom and the distant dad. Yeah, absolutely.
Well, and this is on the heels of Meet the Flockers 4 is about to come out, which is like the ultimate Jewish parent.
I didn't even know there was a 3.
I guess there was a 3.
So is Babs going to be in it?
I don't know, but like that, her as the crazy hippie Jewish mom, and that was like one of the most joyous moments.
And isn't it also Dustin Hoffman? Anyway, YouTube member and patron from the San Francisco Bay Area, she says, I noticed many YouTube and TikTok self-help gurus talking about shadow work,
which is a Jungian concept.
Yeah. It sounds like a great self-help healing method. How would you define it?
Oh, boy.
What are Jordan Peterson and Teal Swan missing? Is it oversimplified on TikTok? How would a trained clinician use this in a legitimate way? Also, can this be used in dreams? Rebecca, what do you think?
That's all, so Jungian dream work these are all Jungian concepts. So I have to say I am not a TikTok watcher, and I don't know who those two people are that just.
I do.
Okay, so you will feel if I'm not answering it, you'll. So this is work that I do a lot with clients. This is actually a directive that I've been doing for years to draw your shadow. So the concept is that within us, all of Jungian concepts begin within us. There is the part that we want to avoid the most. So the classic Jungian moment in pop culture is when Luke learns that Darth is his father, right? Within all of us is this part that we would like to not be there, that we do anything we can to reject, to distance ourselves. And shadow work is, if you can befriend your shadow, you can be way more integrated and tolerate the parts of yourself that are distasteful to you, or more than that. If we get into Jungian dream work, that's a whole nother thing. But Jung would have clients bring in their dreams and discuss them, and would have them then imagine, who are you as every part of that dream, but it's way more complex than that. I don't even. This is like
No, you
graduate
described
level
it. You described it
work.
well
I
enough.
can't even get into it.
The only thing I would add, I guess, or emphasize is that it is the goal of it is to integrate it, not to change it necessarily, but to accept it, embrace that part of yourself, and find its voice and what it's trying to tell you to do.
And
It can
befriend
it can feel like a threat. It can
Yes.
feel like something that is going to destroy you or shameful. Sometimes it's quite obvious the reason as to why we have made it into a shadow. Like if you're gay, for example, that can be a shadow part. That can be a denied aspect of self.
Or I was thinking the sex therapy work I'm doing, like porn addiction, where someone is like, or any kind of addiction. I have this horrible thing in me that I wish it wasn't true, and I do everything I can to keep it secret from everyone.
Yeah, even
And
myself.
and it controls my life, and I keep going back to it. And it's
Yeah.
like, okay, if we can get in there and figure out what are you what are you doing?
Or it could be aggression, anger, violence. At least that's the way it feels when it's sectioned off or shadowed.
And with my ADHD clients, it's often their ADHD symptoms. It's, why am I so forgetful, so messy? So why can't I do the things? I hate that part of myself.
Yeah. And for some people, they'll go into denial about something like that and will act like everything's fine and deny that they do have symptoms of ADHD because they can't accept it yet. There's a difference between being ashamed of something but very aware of it and actually having it be a shadow, which is to mainly be in denial, like the individual just doesn't even recognize it consciously. You can make things half shadowed, but anyway. Jordan Peterson, Teal Swan, I haven't heard anything directly from my memory that they've said about it. I'm guessing that they both have good and bad things to say about it, contrary to what a lot of people will say. Both of these individuals appeal to people for some legitimate right-headed reasons. They have good things to say or helpful things to say at times. But they also have a lot of problems. I've done whole breakdown, takedown videos of Jordan Peterson and Teal Swan pointing out the highly problematic things that both of them say. But they also say things that are things that absolutely I could get behind and have. But I haven't heard them speak directly about the shadow. I think that Jordan Peterson probably, when he's talking about shadow, because he, at least over time, he's become, in my perspective, more and more conservative in his outward communication, outward teaching. And he's big on this sort of traditional masculinity thing. And so I imagine that his shadow talk has something to do with that, of like, there's a lot of men out there who have shadowized their true masculinity and they have to like bring it out. I don't know. It's just a guess.
So just on the flip side, if you want to go down the Jungian rabbit hole, there are so many great podcasts on Jung, books. You can read the source material of Jung. You can attend a Jungian conference, or every major city has a Jungian foundation, and you can attend one of their talks. Jungians love to share and talk and think and bring you in. It is an incredibly complex theory. It's one of the foundational Western psychology theories. And he was a peer of Freud. Is that correct?
Yeah, student.
Yeah. And they broke over, I believe one of the things they broke was Jung's focus on the collective unconscious versus early sexual problems that defined. I'm not saying this very well.
No, you
Am
are.
I right?
Well, their relationship was complicated.
Fraught.
I have a book behind me that's literally just the letters between the two of them. It's this thick book that just has the massive amounts of communication and the details that are in there. You know, the way that each of them thought as they were developing their thoughts, the mentorship that Freud gave Jung, their disagreements. There's a lot of nuance there. It's a complicated relationship.
So I consider myself deep down a Jungian. So much of the tarot work I do is based on Jung's work. But also, Jung was a fantastic visual artist, and there's a book, I believe it's called The Red Book, it's printed like massive format, like 2 feet by 1.5 feet.
Yeah,
and
we
it's
had a
very
whole
thick.
ceremony at Antioch.
Welcoming it.
Yeah.
And it's full of mandalas that he would paint about his dreams. And they're exquisite. This was this man was not just a really talented psychologist, but an incredible visual artist. So, everyone do yourself a favor, go down the Jungian rabbit hole for a day or so.
Speaking of things that I've rewatched that I had seen before is the movie with Fassbender playing Jung.
Is it Jung versus Freud or something?
Well, no, it's the something method. I can't remember what it's called, but Keira Knightley plays this infamous or famous patient of Jung, and it's at a period of time when Jung was young and they were still involved, Freud and Jung, and the movie speculates about the sexual relationship between Jung and his patient. It's very divisive as a movie because I think it's a Cronenberg movie, I'm not sure, but it is very S&M and very sexual and is taking liberties, and so all my Jungian friends hated the movie.
I never saw it, so I can't weigh it.
But I like it because there's not a lot of movies out there that depict this time. And Viggo Mortensen plays Sigmund Freud. It's a pretty fascinating movie. But yeah, it seems to go a little far with the S&M kind of stuff. But I don't know, I feel like people in our field should talk about this movie more because...
Maybe I'll watch it and we can do a podcast on it.
It does get at a lot of the foundation of our field and of the way that patients would actually present back then, with hysteria and stuff, because there was a lot of conversion and a lot of people that were struggling with things clearly, and it would manifest in what their culture in Austria or wherever they were, Switzerland, the way that they thought that people should manifest psychological issues unconsciously. Conversions are when we have a psychological stress and it converts into a somatic response like numbness or blindness or paralyzation.
Or hysterical fainting.
Right. It's hard to know if that's actually what's happening because you can't really scientifically measure this. But
side note,
what?
When I went to the Evergreen State College in the late 80s, early 90s, all of the women's bathrooms had what we would call the pass-out couches. I don't know if they were for, who knows what they were for, but I think every public women's bathroom on campus had this little side room that had a bed in it. And we all thought it was so funny. The men's rooms, the men were all shocked. What are you talking about, the bed? We don't have a bed. But I thought, were this for the hysterical passing out? What were these couches?
Yeah. For? So it seems, and even today when we look across cultures, there are different somatic conversions in different cultures. Like in the United States, we have fewer conversions, apparently, seemingly, than we did 100 years ago. Presumably because we have other ways of expressing unconscious stress. And we have more likelihood of someone that will help us by listening to us or something like that. Again, it's a generalization, but in other cultures, not only will those supports not necessarily be there, but there's a different indoctrination into the way that your body should express stress. And in the 100 years ago in Europe, there was a different idea than what we would see today in terms of how the body should manifest stress. And of course, women are more stressed in general, particularly back then because of the massive sexism and all that kind of stuff. So there's even more need to express somehow, And so it seems as though people like Anna O, Bertha Pappenheim, the famous patient of Joseph Breuer, who was Freud's mentor, which is all of psychoanalysis is based on that relationship, and Spielrein, Anna Spielrein, I think her name is, the one with Jung. Anyway, I'm getting down the rabbit hole. Another email. But let's take a break. What did you say?
I'm super impressed with your name recall.
All right, another email, listener Holly, she says, can you experience countertransference as a teacher? I hear you describing it within the context of your context. I hear you describing it in your profession, of your professional, and it's there's some type. It seems familiar with dealing with. Sometimes a student can really get under my skin, and I have a hard time separating this feeling from what I am supposed to do as a teacher. How can teachers deal with this? We don't have supervisors like you do.
Yeah.
What do you think?
Yeah, I think it is ever present. I mean, to go back to Jung, this person is probably annoying you because some aspect of yourself or someone you love is popping out through this person's words or actions. And so anyway, and I'm so sad that most fields don't have supervision. Like lawyers also don't have supervision or consultation. There's all these intimate professions that the person's personality can really impact treatment. We have so much evidence of this, or can influence teaching. And so, yeah, I would say to try and relax and see this person. Well, I don't know. How do you explain how to address countertransference in the moment? I usually say try and acknowledge what you're getting triggered by, why you find this person so annoying.
Well, it's a topic that is in the literature referred to as countertransference management, which is a whole system. So it depends on the countertransference, it depends on you, it depends on where you are in your career. With certain countertransferential reactions to clients and students, I suppose, with certain topics of my countertransference, I can instantly recognize and deal with it without having to seek consultation, because I've sought consultation so much and been through so much therapy around it that I instantly recognize how it feels, and I'm so familiar, there's so much practice that I instantly know the pitfalls. Like I can do all this within like a couple seconds. But in the beginning of my career, I wasn't even aware that this was happening. And then at mid-awareness, I would be having the feeling and sort of aware of it, and then I'd have to think about it or talk about it afterwards. So, it's various different approaches to this and case by case, but and some countertransference is related to traumas of ourselves, and some of them are not. Some of them are induced, or some of them are just regular feelings that you get as a therapist or as a teacher. And yeah, how do you deal with it when you're a teacher? The same things that you do when you're a therapist. You become aware, have a system, and don't tell yourself, well, next time I'll just handle it better. You've got to prep, and you've got to do the work, and you've got to dig deep, and you've got to figure out what's going on there. Because if you have a vulnerability, then it's incredibly important and very fruitful in all aspects of your life to become aware of it and heal from it, so that it doesn't affect negatively your body and mind and soul and emotions in the moment, but also won't interfere with your professional efforts, So,
Yeah, and I think often the first step for me when I'm experiencing countertransference is, why is this behavior so annoying to me? That's the first step. Would this be as annoying to anyone else? What is happening here? Why am I so triggered? And I just want to acknowledge, for teachers, there's often, it's true for therapists, but there can really be institutional pressures that are different. They're expected to teach this kid this certain thing in a certain amount of time. I mean, therapists can also be under those time constraints. And I work with a lot of teachers in my practice. And, sometimes it's that kid isn't going to, what the external pressures can really impact how you're feeling about a student.
Absolutely. Another aspect is that being a teacher is more akin to being a group therapist than an individual therapist.
Yeah, and the relationship, if you're seeing them hourly 5 days a week, that's a very intense relationship.
Right. You become very much entwined in each other's psychologies and the roles that develop in particular systemic groups, in particular, systems where there's a scapegoat, there's a star, there's the silent one, particularly when there's stress in the system. So everyone is being gravitated towards and allocating themselves into a particular role. The problem with roles is that they become more pronounced, more rigid, more exaggerated when the system is stressed out, and each individual is not allowed to be flexible to meet their needs given the scenario they're at. One more email.
One more.
Super long-term patient. So I changed.
Super long-term.
I changed the form to allow for not only 3+ years, but also 6+ years. And Serenity from California, whom I know I have met, but you might have met Serenity as well. Serenity is a very long-term, high contributor to the podcast.
Thank you, Serenity.
She says, I was wondering why the majority of therapists are ineffective and seemingly poorly trained. Ever since my old therapist died in October of 2018, I've struggled to find another therapist who both has the correct theoretical orientation and training and is also a good fit for me. I've tried many therapists since then. Some have lasted a few months, others a few sessions. I can't say any of them has really helped me. I feel like most therapists are only able to address surface-level symptoms and not the root cause of those symptoms. It's like if you have lung cancer and you go to the doctor and all they do is prescribe cough syrup. My issues are mostly caused by childhood relational trauma, and I think relational psychodynamic therapy works best for me. Psychodynamic therapists are hard to find, though.
Yes.
And even when I do find one, they're often super boring, and I can't connect to them, let alone attach to them. It's super frustrating, and sometimes
Serenity does not have serenity.
Sometimes I feel hopeless. I realize insurance companies favor short-term therapies like CBT, but so many therapists don't accept insurance, and so I don't understand why this preference by insurers dominates the field. I think your podcast should be required listening for clinicians. So I'm annoyed when I tell a therapist about your podcast and they have no interest in listening to it. End of email, Serenity.
Oh, God.
What do you think, Rebecca?
Yeah, I also fear my therapist will die and I will never be able to find another therapist as good as my therapist. So you're living that, and I'm so sorry. It sounds like it's been a multi-year struggle at this point. So I would look at a psychoanalytic. There must be a California Psychoanalytic Association, and check out folks there. Training in different parts of the country is really different. If you lived in New York, you'd find tons of psychoanalytic therapists. You're not going to find as many as in California because that focuses on marriage and family therapy. So there are regional differences in the work. We haven't talked about this at all, but any minute now, the multi-state pact is going to open up, and therapists are going to be able to, just like traveling nurses, therapists are going to be able to work. I think there's 33 states. So hopefully that will open things up for you. You can maybe see someone who's trained on the East Coast. Therapy is hard. I wouldn't say that the training is bad. I would say that a lot of therapists are afraid to go deep. It's hard work. I don't know. What do you think? I can't think of what else to say.
I think the training is bad. I think that, and this is just my sense of things based on my limited pocket of experience, but I think that the training has either shifted more towards CBT, but also just more towards, I don't know how to describe it. When we were in graduate school, the professors, the baby boomers who were teaching us, there was a greater likelihood that they had a lot of depth. And whether they call themselves psychodynamic therapists or not, these were the people who seemed more like Irvin Yalom,
Yeah. I'm thinking of Phil Cushman.
Phil Cushman, these kinds of people.
Sage.
Yeah. People who you wouldn't even be able to lock them down with a particular theoretical orientation.
Dr. Gwendolyn Jones. I
Yeah.
mean, they were amazing.
Yeah, it was about philosophy and depth, and they had much more foundation in actual humanistic therapy and philosophy. There was a lot of psychodynamic philosophy that was also integrated. You know, they knew about CBT, but it was just like a tool that they would use. But the foundation of who they were and the person of the therapist, the wisdom that was required and the way that people talked. And you and I came up under those people, and I am very much in that world. I know you are too. But the new generation of therapists are being taught by either Gen X's or even millennials who are good people, and many of them are great therapists. I'm not generalizing at all. The way that I see it in terms of the shifts in emphasis is that the con to the way we were trained was there was very little professional ethics and professionality that was taught to us. We were taught by people that might not ever even talk about that. It was just like, let's sit in a room and sit on the floor and talk about the meaning of life and that kind of stuff. Whereas today, because of the effort to professionalize that's been going on for a long time, our profession, and for a lot of good reasons, there's a lot more emphasis on professional ethics and being professionalism, how to make money and how to keep good notes and how to not get in trouble. And all those things are absolutely important. People listen to this podcast know that I'm a very big proponent of that kind of emphasis, but something has to be sacrificed. And I think what gets sacrificed is sitting in a circle and talking about philosophy and about the meaning of life and about the human experience and about what, Bugenthal and Carl Rogers and Freud and Jung and Karen Horney and all these people, Irvin Yalom, what they can give us, instead of just reading the summary of just like, here's how you actively listen to someone. Carl Rogers said, you just repeat what they say back to them. Like the reduction that happens to humanistic psychology is a crime, I think. And that's my sense, is that something had to go. And when ethics was being emphasized and the worry of the scrutiny of the public and the shame of having famous cases where people would have sex with their clients or being called out for this and that, there was an effort to fix that, which is good. But like I said, something had to go. And then you add the emphasis of insurance, you just have to follow the money, and the emphasis on short-term therapies and CBT. I feel like on average, they just don't like the kind of philosophical musings within psychoanalytic thought. And they're just like, look, all that's bullshit. And let's just be pragmatic about this. You know what I mean? And there could be some wisdom to that. Short-term therapies can be great. Solution focus, narrative therapies, these are short-term therapies. But all of these movements have conspired to result in what I think to be an unfortunate result of fewer therapists that actually know how to help people, that actually know the foundation of the human experience and how therapy actually works, or how it can work in a way that is more suited to a lot of clients. Because CBT can be very helpful and is very suited for some scenarios. Absolutely. I use it all the time. But I do think that there is something lost.
Well, and I'm wondering if this is why IFS, internal family systems, is so popular right now, is that it allows for people to enter into something that's a little deeper as a way of studying, to sit with the client with a concept.
Yeah. I mean, I've always said that IFS is basically just a simpler way of explaining psychodynamic or Gestalt or other more elaborate systems of understanding. Plus, a lot of the writing in psychoanalytic literature, object relations stuff, self-ego therapy, it's so
Klein,
old and so it's so impossible to understand.
Hostile rejecting breast.
Yeah. Well, that is like, well, at least there's somewhat of a kernel of understanding that we could relate to. But if you just read Klein, yeah, most of it's like, what the fuck are you talking? But it was also 100 years ago. They were dealing with a different language system. So I just think a lot of factors are conspiring to result in a lot of therapy. And then the current problem is you have a whole generation of therapists that are halfway in graduate school, and another half of them is on TikTok. And there's a lot of really stupid people on TikTok talking about things that they don't know anything about, including clinicians.
Well, and also the move that everything's online. I mean, there's a whole section of clinicians that have barely sat in a room with a live person, and that's so different.
Yeah. I mean, I hope that doesn't negate the possibility of good instruction and supervision. And I'll say this. I'm generalizing. There are plenty of professors out there, plenty of students today that are absolutely, completely in my and your camp along these lines. I'm not saying that it's all like this. There's every professor is different, every program is different, every student is different. But it is worrisome. I see a lot more therapists today that have basically no understanding and no way to gain understanding that I think is required to actually help people like Serenity from California. And I, that's the question that she's saying is like,
who's deep enough for me?
Yeah. Why is it so hard to find a good therapist? Now, the other thing that I'll say, Serenity, to you specifically, is that you had a really good relationship with a therapist for a long time, and then your therapist died.
Yeah. I would say, Serenity, if there's one gift we can give you today, it's go to a several-day grief and loss retreat to deal with this loss that is clearly influencing you now and your ability to reattach.
Right.
And there's no way that can't. I mean, I one of my dearest friends is retiring, and I'm getting a bunch of her different clients, and one of her clients who's come to me is so sad. And we talk about that, and we sit with that. And she's like, I don't know if I want to come back. And I'm like, I totally get it. I'm not, and I am equally sad that my friend is retiring. So we both have grief about this. But, we sit in the grief and the loss of it. I remember one time I was with Kaiser back in the day. No, it was Group Health then. And I was at the big Kaiser Center seeing a therapist, and they fired my therapist. And then he just gave me someone else. And I was like, I need to process with the fact that, like, I had a different therapist and now I have you. And she was like, that's not why I'm here. And I was like, well, then I can't see you. Because if you can't address with me the loss that, like, some corporation just fired my therapist and I worked with them for, like, 2 years, then, like, we're not a good match. So, yeah, the loss of a therapist can be huge. If it's someone that you can really talk to.
Right. And so, as I think you're getting at partially, at least, is that loss can make it very hard.
Because no one's going to be that person, no matter how smart they are.
Even if they are of that ilk, it will take a long time to develop that. And so there's a possibility that you're saying that the ones that you do find, they're boring. And maybe that's the case. And, you were spoiled with a good connection and a good therapist for you, a good fit. And so what you might be running into is just it takes a long time. It's kind of like dating. It's hard to find a good match.
Yeah. And why was this? I don't mean to psychoanalyze you, Serenity, but you wrote in, so you know what you're getting. Does this attachment wound repeat any previous attachment wounds? Or was there no good attachment before, and this therapist was the first attachment? But if a pattern like this, if you cannot find a good therapist anywhere, I'm just curious, what are you bringing to this situation?
Yeah.
Because at some point, we're in the Winnicott category of, like, who can be good enough.
Yeah.
There's nobody that's going to be that person who left us.
And just one final little tip is a way to expedite the Tinderification, if you will, of finding the right therapist would be, instead of actually meeting with all the therapists, you actually just email them or talk with them on the phone for 5 minutes and just have a prompt that you ask them.
Are you funny?
Well, I would ask, I have childhood relational traumas related to this and that. What's your general approach? To me, I would imagine that would be a very good screener, particularly if you did it over the phone, because they wouldn't be able to think about it. Because if you asked me that question, I would have a very concise answer, and I would understand what they're getting at, and I would understand that they have run into other therapists that don't have a good approach or don't seem to have any clue what you're talking about. So you can quickly eliminate a lot of people without having going through all the problems. Then once you get past that, so maybe the second question is, tell me a joke. All right. Well, that does it for that episode. Everyone out there, please take care of yourself. Find a therapist that fits with you, because
it's worth trying again.